This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now look at the notes for Extract 1. Extract 1. Questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, Mrs. Simons. Thanks for coming in today.
I just wondered, Doctor, I got this letter from your receptionist, I think it was. I was wondering what to do with it, but it says I should come in for a routine 6-month checkup. But I think I was only here a few weeks ago, wasn't I?
Let's see now. It's October 28th today, so it's just over 6 months since your last visit.
Really?
Yeah, actually it was in March.
Oh my, time flies. I thought it was only a few weeks ago.
Yes, time certainly does fly, that's right. Now tell me how you've been for the last 6 months. How have you been going?
I think it's just the same as... no, I did have flu actually. My son, he lives in the city and he came to help me. He's my only son, that's Tom.
Okay, and was the flu, was it a bad flu? I don't think I saw you.
I think it was all right. I got better anyway.
Okay, good. And yeah, I do know Tom. We were in school together, and he did come with you on the last visit in March.
Oh, yes, now I remember. He does know you, doesn't he?
That's right, he does.
Well, anyway, he came to help me, but I'm fine now.
Well, that's good. Well, look, let's just check out a few things, shall we? Could you just step on the scales for me, please?
Oh, I don't think I've put on any weight. I've never been fat.
No, you certainly haven't put on weight. In fact, looking at this measurement, you've lost over 4 kilograms. But we'll talk a bit about that later. I'd just like to check your blood pressure.
Oh, well, that should be okay.
Yeah, it's not too bad. It is a bit higher than last time, though. Now, Ivy, does the Webster pack the pharmacist made up for you, does that help you make sure that you take the right medications every morning?
What medications do you mean?
It should have your Carvia for controlling blood pressure and the Oroxine tablets to ensure that your thyroid is functioning adequately. And then there's the Lipex to keep your cholesterol levels under control.
Oh, yes. My chemist has been very good to me. He keeps track of all my prescriptions and sets everything out for me, so I know what to take each day. Of course, sometimes I notice I seem to have missed a day here and there. But one thing I always take is my vitamin C and my vitamin E. I've taken them for years and they're very good for me.
Well, I'm pleased that that's working for you, and it is very important that you take your Carvia, Oroxine, and your Lipex as well. So perhaps if you leave the Webster pack in a place where you'll always see it when you wake up in the morning. Well, Ivy, can you tell me more about how you're managing on your own on a day-to-day basis?
Well, I'm managing myself, I think, but I am having a few problems. Tom got a gardener for me to help out with the garden.
Well, that must be a help for you, actually.
Oh, I don't know about that. Quite frankly, Tom seems to think he's okay, but I don't know what he's doing. I think he's stealing my tools.
That's rather unusual. What makes you think that?
Well, several things have gone missing, like my garden gloves and my digging fork, which I use for putting flowers in, and my watering can as well. So that's why I'd like to get rid of it.
Do you have any help with the housework?
Oh, I can manage that. Oh, yes. I've got a home help lady that helps. Some help people came round and they said I could have help with cleaning the house. But I don't think these people are really trustworthy. Now, you take this morning. I wanted a cup of tea. I always use my favourite teacup, and this morning it was gone. Now, the cleaning lady was there yesterday and she must have taken it. And I also think she's hidden the remote control for the TV.
Yeah, as I said, it doesn't seem normal that people would do this. Do you think that maybe you might have misplaced these things, perhaps?
Oh, I always put things in the same place, and I've been doing that for years.
I see. Well, maybe this is something you should talk to Tom about if it's worrying you.
Extract 2. Questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Come on in, Henry. How are you this morning?
Not too bad, thanks, Doctor, and yourself?
Oh, well, busy as usual.
Yeah, I can see that. There are a lot of customers in the waiting room.
Yeah.
There was a nice spot of rain we got last night.
Yes, it certainly saved watering the garden, and that was a bonus. So, Henry, have you come for your blood test results?
Yeah, that's right. Give us the news, Doctor.
Well, it's not bad news, but your total cholesterol was 6.6, your triglycerides 1.6, and your HDL was 1.54, and the LDL was 4.65.
So what does that all mean, Doctor?
Well, you remember we did the same test a year ago?
Yeah.
So what these current results show now is that compared with last year's results, there has been a sharp rise in your LDL level.
Yes, well, what's brought this about?
Well, as we discussed last year, cholesterol is carried in the blood by different types of protein carriers called lipoproteins.
Yeah, I remember that.
Well, the two which carry the most cholesterol are the low-density lipoproteins, LDLs, which we believe promote atherosclerosis or thickening of the arteries, while high-density lipoproteins, HDLs, tend to prevent this. In your case, unfortunately, your LDL has increased, and there are a number of factors that may have contributed to the rise in your LDL. For instance, a higher fat content in your diet,
Right.
increase in stress,
Mm-hmm.
maybe you're not exercising as much as you were.
I guess I'm not.
That's right. Have you noticed any discomfort or had any general health issues that have caused you concern lately?
No, not really.
Okay, now Henry, I know your family history and that your dad died of a stroke at 60. I just want to ask you a few questions about what you're doing now.
Sure.
What about your current diet? Are you eating much fatty food?
Yeah, I guess so. I do enjoy McDonald's at lunchtime and eat quite a bit of meat. I'm not really a big fan of vegetables.
Yeah. Have you noticed any change in weight? Do you think you've gained a little?
Well, since I last saw you, I've probably put on about 5 kilograms.
Yeah, well, that's quite substantial. What about exercise? Do you still manage to do that regularly? I remember last time you told me that you were taking your dog for a run once or twice a week and that you swim regularly.
Well, actually, in the last year I've been pretty busy at work and I've had a lot of family commitments lately, so I'll probably exercise a bit less.
And are you still smoking?
Yes, I am. I've tried to cut down though. I'm probably smoking 5 or 10 cigarettes a day.
Okay. And how about alcohol? How many alcoholic drinks do you have in a week?
Well, in a week, I probably have 2 or 3 a day, so I don't know if you multiply that. I guess it adds up to quite a few, 16 or more maybe.
And would you say that you drink more at the weekend?
Yeah, a little bit more on the weekend. We have a glass of wine as well at night sometimes.
Right. Okay. Well, what about your work? Is it any more stressful?
It is actually. Since that economic downturn, we've all been putting in longer hours, trying to drum up a bit more business, so I guess it is a bit of a stressful time.
Okay. Well, judging by what you've said, I'd say there are a number of things that certainly could be impacting on your health. Now, Henry, based on what you've told me, you do have some risk factors, and I'd like to talk to you about ways we can minimise these, if that's okay.
Sure, Doctor.
So the best way to maximise healthy levels of your cholesterol is through diet, of course, and taking account of the things that you need to avoid.
Yeah, I see.
So let's talk about some simple dietary measures. Firstly, of course, you should try to avoid fatty meats and processed meats like salami, sausages.
Okay.
Also, you need to cut down on snack food, such as chips, hamburgers, all those little things you probably love.
Yep.
And takeaway food, of course, especially deep fried food. I don't know whether you have a lot of takeaways.
Well, I do. So you mean no more McDonald's, Doctor?
That's right. It certainly would be better to avoid it. Just try it grilled instead.
Okay.
Part B. In this part of the test, you'll hear 6 different extracts. extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B or C, which fits best, according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear two nurses conducting a patient handover. Now read the question.
Mrs. Garner's a 73-year-old who came in because of an exacerbation of COPD. This is day 3. Today she's down for a repeat chest x-ray, and that's all booked in, and her leg dressings need to be done. She has bilateral ulcers. Oh, and you'd better chase up the report on her sputum sample. We should have had that back by now.
Okay.
There's a history of ischemic heart disease and type 2 diabetes, peripheral vascular disease and peripheral neuropathy. She's been treated with IV antibiotics, steroids and nebulizers. She's mobile with a walking frame but gets breathless. She's down as high risk for falls.
Sure. I'll continue to monitor her fluid intake and check that she sticks to the diabetic diet.
Great.
Question 26. You hear a GP talking to a patient. Now read the question.
So, shall we have a look at your blood test result? So, what we're testing for is the level of hemoglobin in your blood. And just to show you, the normal range for women is between 11.5 and 16 grams per deciliter.
Oh, yes.
And this is your level of hemoglobin. It's 8.7.
Oh, I see.
And what this tells us is that you're suffering from iron deficiency anemia.
Oh, yes. I thought that might be the case. That would account for the lack of energy and the, lethargy. I think that's what you called it last time. So, perhaps I need to look at my diet, increase my iron intake?
Well, what I'd like you to consider is taking a course of iron tablets. This can be a really effective treatment for the condition, and what it does is it supplements the amount of iron you're getting in your diet.
So, does that mean I can go on eating normally?
Not necessarily. I think we'd better run through what that phrase means in your case before I answer that question.
Okay. Question 27. You hear a senior nurse briefing a colleague about working in the recovery room. Now read the question. Okay, so this is the recovery room where you'll be working. Patients come here directly from theatre. It's their first stage recovery before going back to the ward. Here we have a monitor, and on that you can see all the patient's vital signs from theatre, okay?
Right.
So you check that it's on and functioning, attach the BP cuff and pulse oximeter, and you're ready to make your assessment. The system then prompts you in terms of what to do next with the patient.
So, do they get extubated in theatre?
It depends. Mostly they do, and that's ideal. But sometimes it happens outside. If they come out with an ET tube in place, then it's probably because the doctors want to keep it there during recovery. But if it's a laryngeal mask, then the anaesthetist will see to that. We just have to ensure that the patient's kept stable. Question 28. You hear a dentist talking to a patient. Now read the question. So today I'm going to prepare the tooth for the fitting of the crown, then take an impression.
Oh, really? I thought I was having the tooth filled. Have I got the wrong end of the stick then?
Okay, well, if you remember, last time you were here, we discussed the various options for the tooth because there's already a big filling in it that's fractured.
Yeah, and I thought you said you'd be replacing the metal filling with a tooth-coloured filling made out of some sort of composite material.
Oh, yes, I see. Actually, what we discussed was either a new metal filling, which may or may not stand the test of time because there's going to be a lot of stress on what's left of that tooth, or go for a tooth-coloured crown instead, which would be more robust.
And is that what you quoted for in terms of the price?
Oh, yes.
Okay, let's go for it then.
Question 29. You hear a triage nurse in the emergency department talking to a doctor. Now read the question.
Excuse me, doctor. I'm getting concerned about one of the patients I've triaged this evening. He came in with pain in his right shoulder going down the arm, and I put him down for an ECG and blood work. But he's now saying he feels feverish, and he's asking me how long it's going to be before you can see him.
I see. How long's he been waiting?
Around half an hour. The thing is, he's got an infected wound on his leg. Says he's had it for a while, and it doesn't seem to want to heal. He didn't tell me about this initially. I've looked at the wound, and there's clearly inflammation and some discharge. But what's worrying me is that his speech is getting rather slurred, so I'm concerned that it might be sepsis. I think we should move him up the list.
Okay. Thanks for flagging this up. I'll take a look at him straight away. Question 30. You hear an eye surgeon briefing some new staff at the eye clinic. Now read the question. One of the biggest challenges for us can be deciding what's normal and what isn't. Looking at the back of people's eyes, as we do all day, what strikes you is the enormous variety of shapes and sizes you see there. The optic nerve may be oval, it may be round, or it can be irregular in shape, and all of that can be perfectly normal. So we get lots of referrals, particularly of children, where an optometrist observed something a bit funny at the back of the eye, and they want us to check it out. Well, that's fine. If they err on the side of caution, that's better than missing things. And from our point of view, it's all worthwhile. After all, it's only by looking at a great many healthy eyes that you learn to diagnose the problems that we need to deal with. That is the end of part B. Now look at part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1. Extract 1, questions 31 to 36. You will hear an interview with a dietitian called Ben Melrose, who's talking about iodine deficiency. You now have 90 seconds to read questions 31 to 36. My guest today is a dietitian called Ben Melrose, and today we're going to be talking about iodine deficiency and some of the medical consequences of that. Ben, iodine is a trace element that's found in many foods. Why do some people not get enough?
Well, in some parts of the world, this is an endemic problem. And it's not a question of dietary choice. We get iodine from various sources, like there's iodine in eggs and dairy foods. But by far the biggest source is the ocean. Fish that live in salt water and plants that grow in that environment are our main source of iodine. So we see relatively few cases of deficiency in Europe, for example, because such foods are plentiful there. But elsewhere, typically in the middle of large continents, it's a different story. There, people simply don't have access to sources of natural iodine. Obviously, poorer people in those regions are most likely to suffer deficiencies, but everyone's affected to some degree.
And the consequences of iodine deficiency can be quite serious, I imagine.
Yes, classic symptoms are things like muscular weakness, not being able to focus on the task in hand, and also a tendency to feel cold, even in hot weather. But the most widely reported symptom is actually a feeling of constant tiredness. Of course, there are tests that can determine the level of iodine in the body, and 150 micrograms is regarded as the minimum daily intake needed to avoid symptoms. And there are related conditions. A typical one is an enlarged thyroid, what's often called a goiter.
So you've worked in South America, Ben, where I think it's quite common to see patients with a goiter.
That's right. The case of one of my own patients illustrates this very well. Let's call her Mirabelle. Mirabelle's a middle-aged woman whose home is high up in the Andes Mountains. She lived in Europe for a number of years, where she enjoyed a varied diet and good health. When she and her husband went back to their native country, however, they returned to a remote region and tended to revert to the local cuisine, which is lacking in iodine. As they hadn't suffered any of the symptoms of iodine deficiency before they left for Europe, they didn't feel any particular need to worry about their diet now.
But I believe she developed a goiter.
Well, what happened was she started to have problems sleeping. She'd wake up in the middle of the night with discomfort in her legs, and then she started to get a sore throat. At first she assumed it was flu, but the symptoms persisted. Then one day she noticed a slight swelling on her neck. At first she couldn't believe it. The family were eating lots of river fish and fruit, so a diet that was healthy enough in many ways, but crucially lacking in iodine. Knowing this, she'd been taking multivitamins since her return, so was initially sceptical until a test confirmed that this was the cause.
So, were you able to help Mirabelle?
I was able to work out a diet for Mirabelle that made the most of the natural sources of iodine that were available to her. I also encouraged her to eat Brazil nuts. These are a good source of selenium, which actually helps the body to absorb the traces of iodine which are present in other foods.
Oh.
I also advised her to steer clear of certain processed foods, like bread made with flour improver, because these actually impede the body's ability to absorb iodine. I left it up to her whether or not she continued with the multivitamins.
So, what conclusions do you draw from Mirabelle's case?
What it made me think was that millions of people on this planet must be existing on the brink of iodine deficiency, and that's a cause for concern. Like Mirabelle, when you're young, the body can cope, but this takes its toll with time. Another thought I had was, did Mirabelle become more susceptible to the effects of iodine deficiency as a result of the iodine-rich diet she'd enjoyed in Europe? I couldn't say, but that certainly seems to warrant further study.
Questions 37 to 42. You will hear a plastic surgeon called Norma Woolston giving a presentation about surgical treatment for a condition called Dupuytren's contracture. You now have 90 seconds to read questions 37 to 42. My name's Norma Woolston, and I'm talking today about surgery for a condition called Dupuytren's contracture, with a particular reference to a case I treated recently. Dupuytren was first described by a French physician of that name in 1834. It's a condition in which one finger becomes increasingly bent in a flexed position. The first sign is a formation of small hard nodules in the palm of the hand, but early diagnosis is relatively unusual because there is no associated discomfort. In its early stages, the condition may respond to steroid injections and physical therapy, but this doesn't necessarily halt its progression. The affected finger often becomes increasingly bent and can no longer be straightened. But patients tend to present with the condition only when manual dexterity is compromised, by which time surgical intervention is indicated. My patient, let's call him Eric, presented with quite an advanced case of Dupuytren's affecting the little finger of his right hand, a relatively common site for the condition. Although a physical examination revealed that he was also developing the first signs in the thumb on the same hand. Eric was then a 61-year-old office worker who used a keyboard regularly. There isn't very much published so far on the causes of the condition or what might exacerbate the symptoms, but the digital age doesn't appear to have resulted in an exponential rise in the number of cases reported. Eric was finding the condition inconvenient and uncomfortable rather than painful. It was becoming tricky shaking hands with people, and holding a pencil was becoming a challenge. Eric didn't recall any family history of Dupuytren's. That's not unusual, but doesn't in itself mean that there was none. Indeed, we know that the condition is often present across the generations of one family. But because patients don't typically develop symptoms until late middle age or later, it often goes undiagnosed or doesn't develop to the point where it requires treatment. Indeed, mild symptoms are often attributed to mild arthritis or the general effects of aging and wear and tear. Nor did Eric report any of the other associated risk factors, such as smoking, diabetes, or low body mass index. It's worth noting, however, that he was of classic Northern European appearance, tall and fair-skinned, and Dupuytren's is known to be much more common amongst Northern Europeans than in other populations. In Eric's case, the condition had progressed to the point where surgery was indicated. It was clear to me that what was required was a fasciotomy to straighten the finger. Eric had some misgivings about this, as he'd heard about less invasive treatment options. But I explained to him that, taking into account the extent of development of the diseased tissue and the specific site, this was the only option, and he agreed to go ahead with the procedure. Fortunately, Eric was generally in good health, was taking no medications for other conditions, and had no concerns or negative history relating to general anaesthetic. This was much the preferred option because, although the surgery isn't lengthy, usually between 30 and 40 minutes, it does call for a complete immobilization of the hand. After the procedure, Eric was using a sling and pillows at night to hold the wound site high up and so prevent a build-up of fluids. I'd explained that wearing a sling when out and about also provides a degree of general protection. It's a remarkably effective way of signalling to other people to keep their distance, as the hand is very sensitive to knocks. But actually, he'd taken plenty of time off work, so this hadn't been a problem for him. Indeed, when I saw Eric at the follow-up appointment, the wound was healing well. His notes showed, however, that the sutures hadn't all fully dissolved after surgery, and that this had been a source of discomfort. Worried that perhaps there was an infection, he'd consulted a nurse, who'd removed them and also taken the opportunity to excise some excess scar tissue, which had formed at the site. I reassured him that this was by no means unusual and wasn't a cause for concern. I was pleased to see that when he returned for the final consultation, Eric's wound had generally healed well. As is the case with many Dupuytren's patients, however, Eric volunteered that despite my careful explanation at our first consultation about the treatment and recuperation period, he'd entirely underestimated the impact of the surgery on his daily life and how long the disruption would continue. That said, his finger is now much straighter. This treatment for Dupuytren's never completely straightens the finger, nor restores full use, but he'd been aware of that from the outset and had no complaints on that score. So far, apart from the initial indications in his thumb, there is no sign of recurrence, although this is relatively common, especially over time. I reflected, however, that perhaps being very familiar with the condition and having performed this kind of surgery many times, I hadn't made it clear enough to Eric exactly what to expect after the surgery. What Eric's case made me realise is that